Hello and good afternoon, everyone. Thank you for joining our latest Queen Elizabeth Scholarship webinar. We're coming to you today from the McMaster Health Forum at McMaster University in Hamilton, Ontario, Canada. Here's an agenda for today's webinar. I will tell you a little bit about the McMaster Health Forum, a little bit about the Queen Elizabeth Scholarship Program, and then I'll turn things over to our outgoing intern, who's Daniel Liu, who went to Singapore. He's actually the first Queen Elizabeth scholar from our program to go to Singapore, so we'll be interested to hear what he has to say. The McMaster Health Forum is the leading hub for improving health outcomes through collective problem solving. It harness information, convene stakeholders, and prepare action-oriented leaders and act as an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program is run by a partnership between the Rito Hall Foundation, Community Foundations of Canada, Universities Canada, and Canadian universities. The purpose is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. The Queen Elizabeth Scholarship Program that we run here at the McMaster Health Forum is called Strengthening Health Systems. Our scholars contribute to strengthening health systems and become part of our large and growing network of health system leaders. So far within our program, we've had two different cohorts. The first cohort, as you can see here, went away or visited us primarily in the 2016 calendar year. And our second cohort, which you can see here, primarily went away or visited us in the 2017 calendar year. Daniel, who is our presenter today, was in this cohort. And here is Daniel Liu, our presenter for today. At the time of his internship, he was a Bachelor of Health Sciences undergraduate student here at McMaster University. He has an interest in interdisciplinary approaches to problem solving, public health, and translating health research into practice. The goal of his internship was to gain insight on the complexity of health system issues and the processes for addressing them. Daniel is now still at McMaster, however, he is no longer in the BHSC program. He is now in the School of Medicine undergraduate MD program. So Daniel, everyone's waiting to hear from you, so I will now turn it over to you. Enjoy.
Good afternoon, everyone. Thank you, James, for the introduction, and thank you, everyone, for taking the time to listen in. As James said, this past summer, I was a Queen Elizabeth Scholar at the Nanyang Technological University's Institute for Health Technologies in Singapore. So today, I will be sharing my experience as a QE Scholar with you, starting from pre-departure preparations and moving on to the context within which I worked, what I did, and what I learned. Yeah, so to begin, I applied to the McMaster Health Forum's Queen Elizabeth Scholarship in Strengthening Health Systems as a third-year Bachelor of Health Sciences student. I submitted my application in the fall of 2016 for placement as an outgoing intern for summer 2017. I was applying having had experience conducting systematic reviews and synthesizing research evidence, as well as in project development and coordination. Initially, I hoped to apply those skills at the Sachs Institute in Australia, or in South Africa, or in Uganda. But knowing that I could arrange a placement at any Commonwealth country, I was incredibly interested in working in Singapore. As for why, off the bat, and to be completely honest, Singapore appealed to me because it does rank very highly on many indices of quality of life, and it is an attractive destination. But also, importantly, I really felt and still do feel that the lessons I learned in Singapore would translate to Canada and its health system very readily. I was excited to learn from a health system that in many areas performs better than our own, and that is also two-tier. So with privatization of healthcare in Canada as a fixture in our national debate, I was interested in seeing what that might entail in the experiences of patients, providers, and so on. In addition, after Dr. Lavish so graciously arranged a position for me at the Nanyang Technological University, I looked forward to seeing the different ways academia and different disciplines could impact healthcare. So in terms of pre-departure preparations, from January until I left for Singapore at the end of April, my cohort of QE scholars and I received weekly training at the forum, covering such topics as international development, strengthening health systems, as well as more down-to-earth lessons on just budgeting and traveling and arranging our visas. Over that time, I also worked on the Health Systems Evidence Repository and was in contact with Health Tech NTU to figure out what projects I could pursue and to address various travel and work details. One project that we identified during those calls was centered around health systems engineering and exploring how it intersects with health services research and what it might offer to health systems strengthening. So to give you a sense of where I worked, Singapore is a tiny, tiny country located in Southeast Asia off the southern tip of Malaysia. It is a relatively diverse country with 4 official languages, but I can attest to the fact that many, many more languages are spoken there than just 4. It has a population of 5.6 million, and for comparison, the population of the GTA is 6.4 million, yet Singapore is approximately 9 times smaller than the GTA in size. So just imagine fitting everyone in the GTA into just the city of Toronto proper. Historically, Singapore was also a British colony until it federated with other territories to form Malaysia in 1963, but the two separated in 1965. Since then, it has achieved extremely high levels of development, both economically and socially. To give you a sense of its growth, it is now one of the largest market economies in its region, despite having almost no natural resources or agricultural lands. Its economy excels in the banking, biotechnology, and energy and infrastructure sectors, which is in part due to how pro-business its government is. Government regulations and government-linked companies play a large role in Singapore's economy to ensure that it remains productive and competitive. On the two figures, you can see how Singapore fares regionally and against Australia, Canada, and the UK in terms of gross national income per capita. And on the figure to your right, Singapore's period of rapid growth in the 80s is apparent, which is just that green peak in the middle of the graph. Singapore's highly developed economy has also translated to high levels of human development. This table from the UN Development Program ranks Singapore 5th in terms of its HDI. Gender inequality, crime, and corruption are all also quite low, but its government has been deemed almost authoritarian, representing a flawed democracy. But if you do look at this table, you can see how Australia, Singapore, Canada, and the United Kingdom fare against each other, with Singapore achieving also high life expectancies at birth. They have a very educated population, and again, their GNI per capita is quite high as well. Amongst its issues, though, income inequality in Singapore is one measure that has not been addressed well by the government, as there is no minimum wage, and it has been deemed that it would make the country less competitive. It is one of the things I did notice in Singapore while I was there. We're getting into its health system, which I was so interested in before I left for my placement. They have a public system and a parallel private system as well. It is one of the most efficient and accessible healthcare systems in the world. It consistently ranks very highly by the Commonwealth Fund and by other organizations, in part due to the government's role to ensure citizens contribute to their medical savings accounts, the subsidies that are provided from general tax revenue, and the price controls in place. Medisave is Singapore's mandatory medical savings program, which is complemented by MediShield, a low-cost health insurance scheme, and MediFund, a fund set up to help citizens afford treatment if they cannot. Almost all primary care providers are private, and while Singapore does not utilize a gatekeeping system, referrals are needed to obtain subsidized specialist care in the public system. This care is often delivered in public hospitals, of which there are 8, and I was working in partnership with the second largest hospital in the central region, Tan Tock Seng Hospital. Moving on to my placement experience, I worked at the NTU Institute for Health Technologies, or Health Tech NTU, under its director, Professor Russell Gruen. Health Tech NTU was established with the goal to develop and translate new technologies to solve real problems in health and healthcare. Part of that process heavily involves stakeholder engagement and supporting interdisciplinary teams with clinicians, healthcare managers, scientists, engineers, etc. Health Tech NTU acknowledges the complexity and fallibility of development and innovation in health technology, and so addresses it by bringing together expertise, a patient focus, and the appropriate tools to bring ideas from maybe a lab bench to patients and populations. What sets Health Tech NTU apart, which is incredibly important in Singapore's competitive environment, is that NTU has one of the best engineering schools in the world. It's incredibly innovative, very high impact factors amongst its faculty, And also that Health Tech NTU is joined at the hip to NTU's Lee Kong Chian School of Medicine. So in terms of specific projects, I left for Singapore with the notion that I would be exploring health systems engineering, possibly producing some sort of paper or review, and then assessing potential opportunities for it in a Health Tech NTU program. This was an appealing project to me as I wanted a large part of my placement to be centered around learning about how health systems are strengthened, and utilizing engineering principles to do so is both relatively novel and quite promising. So for background, health systems engineering is an approach to health system strengthening, as I've said, that aims to practically apply biomedical and industrial engineering approaches to improve healthcare in 6 areas: efficiency, effectiveness, equitability, patient-centeredness, safety, and timeliness. It is also one of few approaches that views the health system as a complex adaptive system and it treats it accordingly, which I find to be incredibly important as the complexity of healthcare systems and their current operation have given rise to many quality, access, and cost issues that we're all very much aware of. And many aspects of healthcare operate in individual silos currently. And through this project, I learned how systems engineering tools could remedy this and drive integration. So many of those tools that I learned about center around the idea of creating clear processes with little variation that can be iteratively optimized, but also creating those processes with input from specialists from all affected areas. That idea to me seemed incredibly analogous to what the McMaster Health Forum does with its dialogues and bringing together stakeholders. Only by combining evidence with the experience of those on the front lines to get the clearest picture of a problem can solutions be best designed. One quote that stuck out to me as I was doing my research and as I was learning about health systems engineering was by Alan Pritzker, just to the right of your screen. And it's, the systems approach is a methodology that seeks to ensure that changes in any part of the system will result in significant improvements in total system performance. This has parallels to the complex adaptive system school of thought. And really, with this project, while it didn't end up leading to a paper or a review, it has so many implications for the future that I would be excited to continue learning about. The second project I worked on was the McMaster project. And it was a partnership between Health Tech NTU and Tan Tock Seng Hospital. So going over Tan Tock Seng Hospital again, it's the second largest hospital in Singapore, and it sees the greatest amount of activity in its emergency room. Talking to the providers and the healthcare managers, they were challenged by a lack of integration in healthcare delivery and the reliance on their care to be provided in the actual center. They had very little care that could be provided in the community. And because they were servicing an elderly population with more lifestyle diseases, so more cardiovascular diseases, they were beginning to fatigue their workforce and beginning to stretch their limits. So what we found through that project was that traditional models and methods of healthcare delivery weren't adequately addressing Singapore's changing healthcare needs. And also that solving problems in healthcare, solving their problems, would be too complex and too risky for them to take on themselves. So the goal of the partnership was to drive innovation and solve the challenges by working together, where McMaster and NTU could engage stakeholders and facilitate the developmental process, while TTSH would be able to help us bridge translational gaps, and in doing so also create a competitive program that could secure funding from the government. And with that funding also attract some of the best minds, provide the best supportive services, and really solve big health problems. This is the kind of core premise behind McMaster, very simply laid out. It centers around attracting clinicians and engineers with potentially impactful ideas, and then guiding them through a process, directed approach of problem identification, evaluation, and translation, as well as providing them with technical resources and expertise. while we were looking at the innovation landscape in Singapore during this project, we learned that despite the growing investment in research and development and a very strong scientific community that kind of laid the foundations for innovation in Singapore, few initiatives were really translating to outcomes. And that those who were able to secure funding or capitalize on that foundation were academic medical centers able to bridge translational gaps. So we really learned about the importance of translating from lab bench to populations and patients. So with HealthMaster, we wanted to drive the creation of new solutions through collective problem solving and that directed approach. Our focus was on translating research again into innovative healthcare delivery methods and tools. Kind of like the McMaster Health Forum and citizen engagement, we sought to engage key opinion leaders to identify and define high priority healthcare delivery issues and their potential solutions, enable interdisciplinary teams of engineers and clinicians to develop innovative delivery arrangements and tools that create value for patients, and also evaluate those solutions within controlled environments to ensure safe and successful system-level translation by managing economic and regulatory hurdles. HealthMaster, and it was Professor Gruen who came up with the name, is an acronym for modeling, analysis, simulations, test bedding, evaluation, and refining, which really encompasses what we wanted HealthMaster to be. Right, so in this project, while we were assessing innovation in Singapore's health system, we were identifying fragmentation, a really low yield of research and innovation actually being translated into outcomes, and that the existing platforms and groups whose missions were to drive health tech innovation focused more on developing new IP or commercializing products that wasn't translating to value for patients. We wanted, through this partnership, to build our developmental capabilities, and by doing so, in terms of value creation, move from incremental to breakthrough and then to transformative innovation. So as the plan for the HealthMaster partnership developed, I was challenged by the idea of incentivizing or even bringing together all the necessary opinion leaders, process and context experts, and clinicians to really enable problem identification, solution design, evaluation, and eventual implementation. Figuring out even who would lead this partnership, what activities they would engage in, and at the most basic level, what was even possible was difficult for someone like me who was both unfamiliar with Singapore's landscape in this area and developing partnerships. Fortunately, I had the support through this process, and I really learned about the barriers facing health system strengthening or implementing large changes in any system. And then the third project I worked on, closer to the end of my placement in August, was with Tan Tock Seng Hospital's nursing team to address their challenges and plan ways to introduce new technologies that could improve how they were operating. Previously in spring, before I arrived in Singapore, they had already done a needs assessment of what they were looking for, as well as the capabilities and the things that they could achieve. But through discussions with them and through consultations with others, we really decided that bringing in new technologies would require time, engineering mentorship, and resources that could be very difficult to secure. One thing about Singapore and this area in particular, the health technology field in particular, is that all the different healthcare groups, all the different hospitals, both public and private, and the two major universities, National University of Singapore and NTU, all wanted a slice of this pie, which made really collaboration and achieving something impactful very difficult. It really just contributed more and more to the fragmentation and the silos that we were seeing grow in the healthcare system. So for TTSH nursing, we generated a modified approach to a grant call, and a timeline for them to implement for the spring and kind of winter of 2018. Just to go over some of the challenges and what they were looking for. They were looking at ways to introduce smart monitoring, effective communication, and reducing manpower needs. One statistic that really stuck out to me as I was talking to them was how few nurses that Singapore actually has right now. It's not just physicians that they need, but also the nursing staff, because a lot of what they're doing still is very manpower intensive. So if we look at reducing manpower needs, just the situation that they described to me was that nursing spends a large amount of time on straining tasks that are somewhat tedious, somewhat time-consuming, and they were hoping for outputs that would maybe automate it for them or at least ease the process for them. This was actually an incredibly rewarding project to work on because I worked so closely with the hospital and the hospital's nursing staff to go through the wards, to talk to patients and understand their workflow and the challenges that they were facing. So ultimately, after those projects, the lessons I learned really centered around collaboration and how difficult the reality actually is when it comes to health systems strengthening. So driving change and innovation in a system is incredibly difficult. I think that's apparent but needs to be said. There are incredible barriers in place in terms of fragmentation and even making allies of the people who you need to be collaborating with, because with the second lesson, no single person is capable of really creating this big program by themselves. One thing Professor Gruen shared with me that's really stuck with me since my placement was this figure from one of his papers on sustainability and sustainable program planning. And it aided me in conceptualizing how health systems might be strengthened and also the framework to guide my thoughts and planning, connecting health and the data about it with the political, economic drivers, and what the program can actually be. And then a third, more personal lesson was just to ask questions, acknowledge personal limitations, and seek guidance when needed. Going from health systems engineering and working in a more academic setting in terms of doing research and potentially producing a paper was a very familiar task, but then moving towards the partnership and creating these different ways to bring stakeholders together or even incentivize and operate within a Singaporean system was really new and different for me. So just learning to do those things like seek help was extremely beneficial and great, yeah. So I do think those are the lessons I learned, and that is my presentation on my time in Singapore. So I will be open to taking any questions now.
Excellent. Thank you very much, Daniel. It was a very interesting presentation. I will open it up for questions as Daniel suggested. So anybody here with me in the room at the McMaster Health Forum, if you have a question, please feel free to put your hand up. If you are joining us online through the webinar, please type your question into the chat box. I will ask you the first question so that others have the opportunity to think about what they might want to say. So, you know, in terms of health systems, Canada and Singapore obviously have some similarities and some obvious differences. In Canada, one of our biggest issues is the accessibility issue that comes up quite frequently. We have a geographic population that is centered around the southern border with these large expanses to the north that makes it difficult to get services to people when they need them. I'm willing to bet that's not a huge issue in Singapore considering the geographic size. So what do you think, or what have you noticed are major issues with the system of healthcare within Singapore?
You're totally right. With Singapore being so small, there aren't those geographic barriers. But part of one of the issues they are facing right now that does challenge access is the income inequality that exists, and the fact that despite what Singapore has done with its 3M program, so MetaSave, MetaFund, MetaLife, there are still vast proportions of the population who are unable to afford healthcare because Singapore's government doesn't actually cover anything fully. It's all subsidized and involves many co-payments. And part of what I learned while I was there was that Singapore has a very large population of foreign workers who aren't permanent residents, who are coming in from Malaysia every day, who aren't able to access the public system despite working in Singapore every single day. For them, the private system is their only option, and private system in Singapore is incredibly expensive because it is meant to really cater to those who want to pay more for small luxuries or shorter waiting times, and not these migrant workers, for example.
Very interesting. Thank you. Again, if you have any questions online, feel free to type it in the chat box for those in the room. And nobody's putting their hands up, so if you have a question, please put your hand up. Another question I could ask, you are now in medical school here at McMaster, and I know the McMaster program gets involved with patients very early on in the process. You had mentioned that you had the opportunity to speak to patients while in Singapore, so I'm curious how that experience has helped inform your education and what you've learned about that going forward.
Well, going into medicine and healthcare and doing so having not the most experience talking to patients, I was always of the mind that, it's very important to extend life outcomes, extend living, and that really the best you can do in a hospital is help a person survive. But talking to patients and through just the 2 months of medical school that I've done so far, my perspective is really beginning to shift that quality of life might be a more appropriate aim as a healthcare provider or as a healthcare manager of a hospital. While I was going through the TTSH nursing wards, the fact that the nurses constantly had to maybe intubate patients or do various motions, and the fact that a lot of these patients were unable to move or even go to the washroom themselves really opened my eyes to the need for maybe a reevaluation of priorities.
Okay, thank you. Interesting. So I know when we were preparing for your time in Singapore, one thing that we heard in preparation was that Singapore is the most western of all of the Asian Pacific Rim cities. Which, looking at your pictures, I can kind of get that sense. But I'm curious, from a cultural perspective, what is Singapore like, and is it, as a country, just one large city, and how easy was it for you to acclimatize to living there?
So it definitely is a very westernized culture. For the first half of my placement, I actually lived more to the west of Singapore, closer to, I guess, where the bridge to Malaysia is and where the main NTU campus is. But then in the later half, I moved more downtown, closer to the medical school. And just the comparison there in terms of how people go about their daily lives and what stores are like there just really showed a big difference, because in the western areas that's less city, less metropolitan, isn't considered downtown. It reminded me very much of like the other Asian countries that I've been to, in China at least, such as Shanghai or Hong Kong or Beijing. Because Singapore is still very developed, it's not going to be similar to maybe rural Vietnam or Thailand, places like those. But many people, and the people that I talk to, still really engage in traditional, more Eastern practices, cultural activities, And a big part of Singapore is their food. Going to Singapore and planning it and talking to people, everyone would recommend to try as much food there as possible. And I do think food is very telling of a culture, and most of it, if not all of it, was usually Eastern in nature. I didn't see a lot of Western food, unless it was maybe like a Popeyes.
Interesting. So we had 3 students that, as you know, went to Malaysia, and they actually did a presentation last week. So I didn't realize that there was a bridge that connected the two. So, you know, how easy is it to move from Singapore to Malaysia back and forth? Is it similar to what we have here in Canada when we go to the U.S., or is it a little bit more involved in that?
I believe it is very similar. It might even be easier. I never took that bridge myself, but Singapore's subway system does have a stop that is directly outside of that bridge. In fact, when I was worried about my visa expiring, a lot of the advice was to just quickly hop over the bridge into Malaysia, spend maybe half a day there, then come back, which will renew my visa for another 30 days. So based on that, I think it's very, very easy, actually.
Very interesting. Okay. I'll look around the room one more time and put out another call to those who are online if you have any questions. And it's a quieter group today than we normally have. So I think you've done a wonderful job at presenting, because nobody seems to have any questions. So I think I will draw this to a close. I want to thank you, Daniel, for taking the time to do your presentation today. I will now draw everybody's attention to this slide that's on the screen, just to go over a few of the links that we have there. The first one is an informational link about our Queen Elizabeth Scholarship Program here through the forum, so feel free to visit that for more information about our scholarship program. The second link is a link to our schedule of webinars, so all of our scholars do webinars. You'll see that there's currently a schedule there for the fall, and of course we will have more schedules as we have more scholars going abroad in 2018. And then our third link is to our blog page. All of our scholars do write blogs about their experiences, usually on a little bit more personal than what they would present in the webinars. So please visit that blog page to read some of those blogs. I know we just put a bunch of them up in this past week. So please do give them a read. And Daniel's will be up there sometime soon. And Daniel, we want to thank you once again for your wonderful presentation and taking the time today. And we're glad that you enjoyed Singapore, and we wish you the best luck in medical school.
Yep, thank you, of course. And it was my pleasure to present. And if there are any more questions from the recording, they can always be reached at my email in the previous slide.
Yeah, I'll just back it up and leave it there. So there's Daniel's email if you have any questions after this is uploaded to YouTube. And thank you, everyone, for joining us today, and we will see you again all very soon. Thank you.